Welcome to Community Health Briefs, where AI hosts share short, clear stories about research shaping healthier futures. Each episode highlights new work from members of the College for Community Health at Montclair State University, showing how ideas connect to the social and structural forces behind health. In short, this is research you can trust, explained by AI in minutes.
Welcome. We're going to unpack something pretty significant. We're looking at the fallout from the COVID-19 pandemic, specifically the economic stress on Asian American families.
Yeah, it was intense. We're diving into a study that explores how all that pressure, job losses, plus the rise in anti-Asian discrimination, how that affected parents.
And not just the parents, right, but their parenting and then ultimately their kids' mental health down the line.
Exactly. The research we're looking at comes from Dr. Sei Kim at Montclair State University and her colleagues.
Ah, right, Dr. Kim in Family Science and Human Development.
Yes, and their work is really vital for community health because, well, the numbers were stark. Unemployment for Asian Americans shot up incredibly fast early in the pandemic.
Went from what, like 2.5% to 15%?
Just like that. So understanding how that kind of structural shock impacts families, impacts kids, it's crucial.
Okay, so how did they approach this? They used the family stress model, the FSM.
They did, but with a twist. Usually the FSM paints this picture, sort of a domino effect. Money problems stress out parents. Stressed parents maybe aren't as effective, and that hurts the kids.
Right, the negative spiral.
But Dr. Kim's team focused on the positive side. They looked specifically at things like parental warmth, how much quality time parents spent, proactive parenting, the protective stuff.
Interesting. So how did they track it?
It was a short-term study. They recruited 282 Asian American parents, quite a few were foreign-born, through community health centers in NYC and online.
And they followed up?
Yep, check back in after 3 months to see what the effects were on the children's mental health.
Okay, so let's get to the findings, because you mentioned a twist.
Yeah. Here's the first big surprise, the economic stress. It wasn't directly linked to higher psychological distress like anxiety or depression in the parents themselves.
Wait, really? That seems counterintuitive based on the usual FSM.
Totally. And what's more, parents reporting high economic stress actually reported higher levels of those positive parenting behaviors we talked about.
So more stress, but also more proactive parenting. How does that work?
Well, the researchers have a theory tied to cultural values, things like collectivism, maybe saving face. The idea is parents might have perhaps unconsciously hidden their own distress.
Okay.
And instead of letting that stress spill over negatively, they poured that energy into actively shielding their kids, like doubling down on being warm, supportive, creating a buffer.
Wow, so a real resilience factor there. But did it completely protect the kids if parents were buffering?
That's the tough part. Unfortunately, no. The study found something really critical. Economic stress did directly predict an increase in children's internalizing problems 3 months later.
Directly. So even with the positive parenting effort.
Even with those efforts, it means the kids were still picking up on that family stress, the financial worry, maybe the discrimination their family faced.
And it manifested as internalizing issues. So anxiety, withdrawal, emotional difficulties.
Exactly.
Yeah.
It suggests that systemic stress, that economic pressure, it somehow bypassed the parents' immediate coping mechanisms, at least for this outcome, and hit the kids directly.
Okay, that's concerning. But what about the positive parenting? Did it do anything?
Yes, absolutely. This is the other key piece. Those positive parenting behaviors, the warmth, the quality time, they were strongly linked to a decrease in children's externalizing problems later on.
Externalizing, so that's like acting out. Conduct problems, hyperactivity.
Precisely. So while positive parenting couldn't stop the internalizing issues linked directly to economic stress, it really helped buffer against those behavioral problems. It made a difference there.
Okay, so it's a mixed picture, resilience in one area, but vulnerability in another. What does this mean for, helping families, for policy?
It means we need a two-pronged approach. Clinically, we should absolutely build on those positive parenting strengths. These families are already demonstrating resilience there, so let's support that.
Makes sense. Lean into the strengths.
But we also have to address the root cause, the economic hardship, the inequality. That means policy solutions. Things like culturally responsive support. Think financial education in the right languages, job support that understands immigrant experiences.
Right, tackling the systemic issues, not just the symptoms.
Exactly.
So the big takeaway for you listening is this. Parental efforts, that positive parenting, it really does protect kids from certain behavioral issues, the externalizing ones. But that deep economic stress is still a major threat, and it seems to uniquely increase those quieter internalizing problems in Asian American youth.
And that's critical because kids struggling internally often fly under the radar. Policy really needs to focus on expanding access to mental health care, especially for these communities where kids might be most at risk but face the biggest hurdles to getting help.
It makes you wonder, doesn't it, if collectivistic values shape how these parents respond to stress, by focusing on protecting the kids. Maybe our standard ways of measuring positive parenting don't capture everything.
That's a really important question for future research. How can we better understand and measure the unique ways these families show support and warmth, especially under pressure?
Definitely something to think about, how culture shapes resilience and how we can best support it.
Thanks for listening to Community Health Briefs. This podcast was created with the help of AI, verified by the paper's author, and does not necessarily reflect the views of the College for Community Health or Montclair State University. Thanks again for listening, and stay tuned for our next episode. Make sure to subscribe and check us out at www.montclair.edu/CCHL to learn more about us and the amazing work we're doing for community health.